Hello, everyone, and welcome to our October webinar of our 2021 webinar series. Remember the Girls is a nonprofit organization dedicated to supporting and advocating for female carriers and patients of X-linked disorders, a group that is often overlooked by the medical profession. The topic of today's webinar is on genetic testing and genetic counseling for X-linked disorders. I'd like to mention that we will be discussing sensitive topics regarding testing journeys and experiences, and want to remind everyone to be respectful and understanding of the fact that every diagnostic odyssey is different. We'd like to thank the sponsors of our 2021 webinar series, Horizon Therapeutics, Bluebird Bio, Ultragenyx Pharmaceuticals, and Safano Genzyme. My name is Andrea Johnson, and I am the Community Engagement and Research Intern here at Remember the Girls, and I'm very excited to be hosting and moderating this month's webinar. Today, we are joined by panelists Rachel Wessman, Beth Bauer, and Karen Vera, and we will first have Rachel, a genetic counselor from Genetic Support Foundation, share some information on genetic testing and counseling options that are currently available for X-linked disorders, as well as just the overall process of those. After that, we will have our member panelists discuss their personal journeys with genetic testing and genetic counseling, and share a little bit about those experiences and the impact that they have had on their lives. If you have any questions during this webinar or would like to use the chat function, you can use the chat or Q&A function. I'll be moderating both, and we'll make sure to do our best to get to all of those questions at the end of the webinar. First up, I am honored to introduce Rachel Wessman. She is a genetic counselor based out of Boise, Idaho, and she received her master's degree in genetic counseling from the University of Pittsburgh in 2011. She's been with the Genetic Support Foundation since 2018, providing telehealth genetic counseling services. Prior, she worked at a local children's hospital in Boise, Idaho, helping develop and expand their general genetics and metabolic clinics. Her focus has been on pediatric and adult general genetics, and she also provides care in the prenatal setting. One of her special interests is expanding access to genetic services to rural and underserved populations. One of her first introductions to genetics was getting to travel as a child with her mother as part of her mother's cancer genetics research. In her free time, she runs around with her young toddler. Rachel, when you're ready, you can go ahead and share your screen and get started.
All right, perfect. Again, thank you for that great introduction and for having me today. So yes, my name is Rachel Wessman. I'm a genetic counselor. I've been practicing for a little over 10 years. I am based out of Idaho. Today, I'm just going to provide some general information about the genetic counseling and genetic testing process. I'll admit much of this information in this process is going to be centered around how it really works in the United States. So I know for some of our members who are not based out of the United States, it may be a little bit of a different process. So I definitely acknowledge that, but hopefully we'll be able to provide just some more general ideas of how it may look for everyone. So just general disclosures is that I do work with the Genetic Support Foundation. We're a nonprofit that's focused on expanding and increasing access to genetic counseling. I don't have any other conflicts of interest to disclose. General kind of outline of what I'll talk through is just kind of why genetic counseling, what is genetic counseling, who are we, and what that process looks like for an appointment and that testing process with one of us. We'll talk about then the genetic testing. I'll spend a little bit of time just going through some of the potential results you may see come back with that and the different testing options that may be offered to you as you go through that process. It has expanded quite a bit over the years, so it's not just a straightforward single test that we may discuss during an appointment. So for genetic counseling, kind of who are we and why genetic counseling? So, one of the primary roles and really goals for genetic counseling is to provide support and to provide guidance to individuals and families who either have a personal history or a family history, either of a known genetic condition, or there's a family history of a genetic condition, or there's a suspicion for a possible genetic condition. So it's really helping walk through that process. and providing information about what that means for them, for the family, and helping walk through that process in terms of hopefully getting answers with that. Who are we? So there are different types of genetic professionals that you may come across during your journey and as you go through this process. A genetic counselor is a healthcare provider with advanced training. So most of us have master's level degrees, some have PhDs or additional degrees as such. And our training and our background is really in medical genetics and in counseling. Another primary genetic professional that you may come across, depending on the condition that's in your family or the questions that are being asked, are medical geneticists. So those are physicians who have additional training and are specialized in genetics. Medical geneticists and genetic counselors often work very closely together. So there's potential that you'll meet both through that process. Again, really somewhat dependent on kind of your family and what's going on for you individually. There are other types of providers, though, that you may come across depending on where you're located and where you live and what access to services you have. That includes physician assistants or nurse practitioners, other providers as such, other nurses who work within genetics clinics and may have just experience or additional training themselves. How to find a genetic counselor or a genetics clinic. One of the primary sources is going to be talking to your primary care provider or another specialist involved in your care and letting them know what's present within your family, what questions you have, and hopefully they'll be able to help connect you with somebody that's local to you or at least another resource where you can access genetics. Another option is to utilize different organizations that are out there that may have lists or databases or directories of genetic counselors and genetics clinics. There are some more generalized ones. So for instance, in the United States, we have the National Society of Genetic Counselors that has a resource that you can utilize. Other countries are going to have different lists that they can use, and then different foundations based on conditions and other questions may have resources and lists of counselors that specialize in those conditions that you could access. And then there's the just good old web search and just Googling or looking online to see if you can find a genetic counselor that's near you. There are more and more telehealth genetic counseling opportunities that are available too, that you can often find online that way. So once you have been referred or once you have found a genetic counselor, kind of what next? What happens with this process? So one of the parts is really, how do you prepare? What do you do before you are seen? One of the most important things is really collecting information, because that's going to be the most helpful to the provider that you meet with. And so, for instance, if your family has a positive genetic test result that's available, so if you have a copy of a report available to you, that's always helpful to share with the genetic counselor ahead of time, because then they can take a look at it, they can review it, they can look to see if there's been any updates or changes to that interpretation or that information that's available, and really best utilize your time when you meet with them. Or if there's other records, we recognize that there, particularly with some of the X-linked disorders, that some people have clinical diagnoses. They've never had genetic testing based on when they were diagnosed with it. It just wasn't an option for them. And so providing that information and just letting the clinic or the provider know, that's helpful in terms of thinking through what options are available. Talking with your family, getting more details about the family history is always helpful. If there are specific questions that you have, it can sometimes be helpful to write those out and bring those along. In some situations, you're able, and depending on who you're seeing, you may be able to send those questions to the provider ahead of time so that they know that what specific topics you want to discuss during your session. And then think about whether you want to bring someone or have someone attend that visit with you. Sometimes it can be helpful to have somebody else there to listen in and to help ask those questions or provide some of the information that's being asked. There's going to be multiple different ways you can go through this process. So if you've not had genetic testing, you may go through what's called a pre-test genetic counseling appointment. And so as a part of that, again, it's going to be somewhat dependent on the condition that we're talking about and the clinic and the center that you're working with as to whether you're just going to meet with a genetic counselor versus maybe you're going to meet with a genetic counselor and a geneticist or another type of specialist as a part of that process. Through those visits, it's going to be similar to many other types of specialty visits where they're going to do detailed review of your history and the family history, talking through what the condition is that's present in the family, whether there's been testing that's been done, talking about what that means for you. There's going to be a big discussion about what are the options that we have, what types of tests do we have available for you? Are there different things that we need to maybe look into ahead of time, or can we go forward with testing at that visit? One of the most important parts of the discussion in that appointment is really going to be talking about what does this testing mean and what could this potential result or diagnosis mean to you and for your family, and really talking through that. Genetic testing is always optional, and so it's always important to feel comfortable with the plan before going forward with it. And that's where I put agreement on plan. It's important to make sure that you feel comfortable with what's being discussed and what's being outlined in terms of the testing plan. Depending on kind of where you're located and condition may also include a conversation about the billing and then the insurance piece and what that looks like for you and taking that into consideration too. But again, it's just the most important part is making sure that you feel comfortable with that plan. And then you have post-test genetic counseling. So if you've gone through this, again, will look a little bit different depending on if you've already had the genetic testing done versus you went through this process with the genetic counselor or genetics provider. Part of that plan that you're going to agree to or kind of talk through with the genetic counselors, how do you want to receive those results? So if you're going through this testing process, do you want a phone call? Do you want to meet in as a part of a visit? There are some entities that you'll go through, you may do genetic testing through where you're going to receive the results electronically before even having a conversation. So important things to consider in terms of how is that going to impact you in terms of how you hear, how you read those results. And then as a part of that appointment, there's going to be a discussion about, depending on what those results are, what does that mean for you? It's not always a straightforward explanation. A negative is not always just this true negative that we can say there's no risk there for you. A positive can have many different types of responses and many different implications that we want to be able to talk through. Particularly with X-linked disorders, we know that there's just so much variability that we can see. There's also a lot of just limitations because of the fact that we don't have a lot of data for what it means for females. And so we have to really kind of piece together, our own experiences as providers, what have I seen for other families and other females and what have they had to go through and what does that mean? And also, what has been published and what is out there about some of these conditions. And then talking through kind of what resources are available and who can we connect you with, both in terms of providing support, but also the medical care that may come along with it if there are things that we recognize that we need to be doing differently to help keep you healthy or to monitor you. And also whether there's things like with reproductive decisions that are now going to be made based on these results. And the most important thing with that, again, is that it's a process, it's a journey, and it's not going to be the same for every individual. Even within families, the process may look very different, and you may get the results in very different ways, depending on, again, how the testing is done and how that looks for you. So in terms of genetic testing, I'm going to start with going through the different types of results that we can see to help kind of guide the conversation of the different types of testing that you may see or be offered through the process. So the most straightforward and kind of simple terms that we can say is that with genetic testing, You may get a positive result, you may get what's called an uncertain result, and you may get a negative result. The positive and negative are often more straightforward and we can provide more clear information. Those uncertain results are the ones that become tricky and make it difficult for us to figure out what do we do next with this. I'm going to throw up this slide where it has a lot on it. I just want to throw up these terms though, so that you can see them. These are what we're looking at when we're looking at results and when we're looking at what we call variance. Variance is kind of the term that we often use now versus using mutations as the term. They're interchangeable a lot of the times. It just means there's a genetic change and that's present. We've transitioned really to using the term variant just because we recognize there's really kind of different classifications of variants that we can see based on the data and based on the information that we have available. So you have these terms like pathogenic or likely pathogenic. Those indicate to us that there's a genetic change there that we recognize disrupts the gene. There's data that's suggestive of it. There's data that suggests to us that this is a positive result for you. A benign or likely benign, the ones at the bottom here, are ones where we all have variations in our DNA. We expect to pick up variants in our DNA. The testing lab, what they're going to do is filter those out. They're not even going to report those out to us and report them out to you most of the time because we recognize that they likely don't impact the gene. They're likely not disease causing. And then you have these variants of uncertain significance, which can put us kind of in a tricky spot of saying, well, what do we do with this? We recognize there's a change that's there, but either we just don't have enough information about that gene and that condition, or we don't have enough information about that variant and what that means for the gene or for that individual. There are times where we can use that and say, well, clinically, we think this fits, and we really do think that this is the answer, and we can make some decisions based on that, but not always. A lot of the times we're stuck in this uncertain kind of gray zone of saying, we're just not sure what this means. And so that's kind of putting it back to those kind of three terms before. So that's where these are the different types of results that you can see come back with different genetic tests. For some testing that we'll talk about in a moment, that uncertain isn't going to be something that we see come back, particularly when we know what we're testing for. But these are just the different possibilities that can come back that as part of that post-test genetic counseling, that's what you're going to go through and talk through. Okay, what does this mean for you, for the family? So genetic testing options. So this is kind of a list of different things that could, or different tests that could be offered through this process. Historically, that first test, the single site analysis, was and kind of is the one that we most often really talk about, particularly when we know what the genetic change is within the family. But as our knowledge has expanded, and really with that, the more we've recognized that maybe there's a lot we don't know through this process. There's other tests that we now may consider, whether it's analyzing the entire gene that's associated with it, looking at multiple genes, and then a test that we call carrier screening. So with single site analysis, it can go by a lot of different names depending on who you talk to, what lab is being used, but single site analysis, targeted variant analysis, known familial mutation, that's all indicating that we have a genetic change within the family that we're looking at. And so the test that we're ordering is saying, does this individual have this genetic change that's present within the family that we know is causing the disease or this condition within this family? And so it's more of a yes or no. Is it there or is it not there? And it's able to give us that more straightforward sort of answer for the individual and for the family. So one of the other tests that we may consider is single gene testing. So why would we do this over doing single site or targeted variant? Maybe we don't know what the variant is within the family. So in those situations where you have a brother or an uncle or a father or grandfather who was diagnosed before genetic testing was really available, or they didn't go through the genetic testing process and they really just relied on that clinical diagnosis. We just may not have that variant, but we know it's that condition that's present. So we know that we can test this gene. There remains some uncertainty with that, because if you're negative for when we do single gene testing, we can't say we've eliminated the risk because we don't know what the disease causing variant was in other people within the family. So we can reduce the risk greatly, but we can't eliminate it when we do this test. Other reasons is that there are certain labs based on their technology and their platforms where single site is not an option through them, and we have to order it as a single gene. And there may be different reasons depending on the condition or location or insurance or other things like that for why we have to order it that way versus doing the single site. Then we have multi-gene testing. This isn't going to be something we see as often for the X-linked disorders, but can occur. So for instance, one of the examples I would use would be Alport syndrome. We know there's an X-linked form of it, but there's other genes that we can see that are inherited in different ways. So this would be an example of if we think Alport's present within the family, but we don't have a genetic change. We may be ordering a multi-gene panel in that situation to confirm whether it's really the X-linked form of it versus one of the other genes or other forms of it that we're seeing within the family. And really with this process, the more you include in testing, so the more that you're analyzing, the more genes you're including, the increased chance you're going to have uncertainty with the testing that comes back with it, that we'll have to review and talk through as a part of that process. And then there's carrier screening. So carrier screening is a test or a term that we use when we're referencing that we're looking for genetic changes in genes that people could be carriers for, that maybe they themselves won't have symptoms or be affected, but there's a family history or they could have a child with it. It differs from the other testing that we've talked about in that not all genetic changes are going to be reported out with it. Only the positive results are going to be reported. So in terms of if there's a variant present, they're not going to report out those uncertain results in this situation. So it's just going to be those what we call pathogenic or likely pathogenic variants that get reported. So that can, in that sense, we can remove maybe some uncertainty that could potentially come back. But because we're not reporting everything out, there's the question of, are we missing something that's not being reported in that situation? So these are things that we have to think through when we're talking about it. A reason that we may do carrier screening is maybe there's an X-linked disorder within the family, but that individual's also wanting to just do general carrier screening for other conditions because they're talking about some of those reproductive risks and looking at options, and they want to include other things as a part of that process. Or maybe they only want to receive back those true positive results, so the pathogenic, likely pathogenic, and they don't want to receive an uncertain result as a part of that. So that's part of the process when we talk through that and kind of talking through where an individual's at, what is the reason that we're doing the testing to help kind of guide which of these tests we may do. One that I bring up briefly, and I won't talk about too much, is called at-home genetic testing or direct-to-consumer testing. It goes by a couple of different names. I bring up this briefly just because you may come across this in your research in looking up genetic testing options. It is a genetic test. It's something that's available and out there. I caution about it because it's not going to be able to answer all of the clinical questions you may have. And if something's identified on it, we can't say that it's a true positive. We also can't say that's a true negative when you don't have something identified. So I really, for these types of conditions, for when there's a family history of something, when we know that there's a specific genetic change in the family, I really recommend meeting with a genetic professional to really go through that process, or a specialist or some other provider to help order clinical-based testing versus doing it through an at-home genetic test. And then this is going to be targeted towards people where this is something that we have to bring up. So particularly in the United States, we have to have a conversation about billing insurance. It's probably my least favorite part of the conversation that we have to have, but it is. It's important to discuss because it's important for you as individuals and families to think through, okay, what are we comfortable with? What are we okay with in terms of what that cost may look like? There are some of the conditions that we know there are programs and there's sponsored testing and options to get that testing covered. But for some of the more rare X-linked disorders, that's not going to be the case. There's not going to be some of those resources that are available. And so there are conversations that we have to have in terms of, particularly when looking at some of those testing options. And then just some general benefits of genetic testing, and we'll talk also about risks and limitations. So by going through the genetic testing process, things that can come out of it is that we can provide that confirmation of the carrier status or potential diagnosis. We can provide insights or explanations for what's going on for you or for your family, and it can be helpful in guiding the treatment and care for you and the family. And then we can use that information if you're trying to make decisions moving forward for yourself. Things that on the other side, we need to consider. So I put the confirmation and that impact on this slide also, because it's not always this positive result in terms of, or positive experience, I should say, when we get these results. It can have a large impact in terms of what it means for you and how do we approach things. And then for some of the conditions that we may be testing for, particularly some of the ones that for X-linked disorders where they've not studied females for some of the conditions, we're not going to have information to guide us. We're going to have to piece it together, and that can be a frustrating experience for everyone involved to not be able to provide good information. And then also, depending on where you live, we have to consider cost, and there may be questions about privacy and data sharing or insurance discrimination as a part of that conversation and thinking through what that means. And then and we'll do questions at the end.
Great, thank you so much, Rachel. That was so insightful, and I think it's really important for us to talk about these options and the process, just because we need to ensure that every individual understands and is aware of the different genetic testings and the background behind all of those that are available to them. So now we are going to have each of our members share personal experiences with testing and genetic counseling. So for our panelists, if you could just describe your journey to testing and counseling and explain the impacts that this has had on your diagnosis and life in general, that would be wonderful. Karen, I will have you go ahead and get us started.
Hi, I'm Karen. I'm from the Netherlands in Europe. I have myotubular myopathy. I found this out I searched for my muscle disease in 2011 when a physical assistant said, what is the reason why you cannot kneel down on the floor? And I had no idea. I said I couldn't. So we went through the process of finding out what I have. And first I went to get it tested. I had a wrong testing. It found out I had the testing showed I had a muscle disease called myasthenia gravis. It's MG. I don't know if it's called correct. So I was sent to a professor, and this professor said, well, whatever you have, it doesn't matter, because we do not have a pill for it, and you will get worse and worse. So whatever the name is, it doesn't really matter for you. Complete wrong answer. So what I did, I wanted to try and look for further for my right diagnosis. He said I didn't have MG, and he said, no, I think you have limb girdle muscular dystrophy. And I said, no, I don't think I have that, because I read a lot of info. And he said, well, what the heck, doesn't matter. So I went ahead and looked further. I'm the only one in my family. I have two older sisters, and my mother has given birth to two boys, but they were dead when they were born. They were stillborn, I think that's the name. I didn't name that to the doctor, but I went ahead and went searching for another doctor. I came to a diagnosis of central nuclear myopathy, which is pretty close to what my actual diagnosis is, but it was a question mark because there are 6 or 7 variations and were tested, but I didn't have a specific one. So I had a question mark. Having a diagnosis question mark is not good for your health. So I said, it's not good, I don't like it. And then I met persons in Germany. It's called Zusammen stark, Together Strong, and they are completely into the disease of central nuclear myopathy. They said, please meet this person. He is located in France, and he's a researcher. And I met this researcher, and he said, please tell me your story. I mentioned I have had 2 brothers who died before I was even born. And once I said this to this researcher, he told me, now we must look for myotubular myopathy, which is exactly the diagnosis I have. It is rare, and it's very rare because I do not have a son, and I do not have a brother, and I'm the only one in my family. And I'm a manifesting carrier. I'm completely in my wheelchair, so I have it severe. And I'm almost the only one here in the Netherlands, which is very strange. It's hard. I cannot respond to anyone who is at my level of the disease. And I find it difficult, but you shouldn't be at this stage of not going on with your disease. So I keep on spreading the news that you should really keep on searching.
Thank you so much, Karen. That is such an incredible journey that you've had, and you've gone through like a whirlwind, it seems like,
Yes.
trying to find an answer. So I applaud you for going through and sharing such a whirlwind of an experience for you. Beth, would you like to go ahead and share? Perfect.
Same disease as Karen, myotubular myopathy, or MTM. I didn't find out that I had this disease or even was a carrier of it until my first child was born. And he was born, he had to be immediately intubated, and obviously was very weak, and clearly something was going on. And so through testing on him, a muscle biopsy, we found out what he had. And so then they knew that I was a carrier, or was presumed that I was a carrier. But at that time, they told me there was nothing for me to worry about. I would never have any symptoms or problems. And I kind of thought to myself, I think I already have some problems, but my son was so involved that I just really didn't worry about what was going on with me and wanted to focus on him. So then they told us that with genetic counseling, that we had a 75% chance of having a clinically healthy child, which meant that if it's a boy, it's a 50-50 chance whether it's the boy is affected or not. And if it's a girl, it won't be affected, but a 50-50 chance if it was a carrier. So my husband and I were talking and decided that we probably wouldn't have any more children, and found out we were already having another. And so that was my second son, and he also was born with MTM. So for me, I didn't find out I was a manifesting carrier until a family conference for MTM in 2013. There were some researchers there, and they offered to do testing if we joined their research study, and then we could find out. And they really strongly recommended that I did, because they could see that I definitely was having trouble walking and getting around. And so that was confirmed then that I was a manifesting carrier. And for me, that was pretty devastating, because I was always the kind of person that was like, there's a problem, I fix it, I find a way, I overcome. And so then it was kind of like a punch in the gut, almost like, okay, now I can't fix this, I can't overcome this, I can't get away from this, this is something that's going to get worse. So that took a little bit of time to just deal with that and just digest that. And so for probably a few months, it was just kind of hard. It didn't like consume me or anything, but if I thought about it, it was just definitely like, ugh, I don't want to deal with this, And finally, I just decided, you know what, I've made it this far. I've worked really hard physically and take good care of myself. I'm just going to keep doing that and hope that, I can continue on. So it's nice to know why I have the problems that I have, but at the same time, it was hard because then I know I can't fix them. And then I had a daughter years later, again, not planned, but she was having a lot of health issues also in 2013 when I got tested. And so they admitted her into the study and found out that she too is a manifesting carrier. And she was, let's see, how old was she at the time? She was 12. And, a lot of parents struggle with, when do we test our girls to see if they're a carrier? And some people think it's much later. And for me personally, I think it's a good thing that they know young. My daughter wasn't sexually active at that time, but I think so many young girls are, that I think that if there's a possibility that they are a carrier, they should know, because it might make them be a little more careful, or maybe choose to wait so that they don't have any accidents and have a child that they're not prepared to deal with. So those are just things to think about when trying to decide if you should have your child tested. My daughter needed to be tested. She had so many physical issues, and it was difficult at school because she had trouble, especially in Fayed. And they were like, well, why can't she this? And why can't she that? And I'd tell them, well, don't you think you should have her tested? And then I'd try to get her tested. And then they would tell me, no, she's too young. You have to wait till she's 18. And I'm like, but she's having issues. They're like, oh, well, that's different. Well, I wasn't asking just out of curiosity. I was asking because of issues. But even for curiosity's sake, I do think it's important for people to be tested and know, because it gives them time to think about it versus, oh, I'm 20 years old and I'm in this great relationship and I want to get married and I don't know what my status is. And then you find out and you tell the significant other too late in the game, and maybe they choose to walk away and you've invested a lot of time, and it, can be a real heartbreaking situation. So I think it's, from my perspective, I think it's better to know ahead. So it's just something to think about.
Thank you so much, Beth, and thank you so much for sharing to both of you. Just some general questions. What advice would you give to women who are looking at their testing options and are feeling as though they're not sure where to start?
I guess if there's any studies for their disease, that's a great place to start, because they have an interest in getting your DNA into their study. So that's a great way for you to get information. If there isn't a testing going on for your disease, any studies, then it's just a matter of finding a good genetic counselor to go to and just tell them what you need to be tested for. And for me, I just asked some of our other doctors, who do you recommend? So
that's great advice. We have a question for Rachel in the chat. Her question is, when should parents first take their carrier or potential carrier daughter to see a genetic counselor?
Yes, yeah, definitely. And I think definitely going off of some of what Beth just talked about too, is that I am definitely an advocate for having this conversation with your daughters and with other people within the family from early ages. Doesn't mean testing has to happen at early ages, but I'm definitely an advocate for um, having that conversation, having them be aware of what's going on within the family. Kids are really smart and they're going to pick up on these sort of things that's going on. And for some of the same reasons that also Beth talked about, that having them meet with someone at an age where it can differ depending on the condition and on the individual. So there are a lot of factors, but it's okay to go and meet with someone earlier than at younger ages, to have those conversations, to set up some sort of plan and talk through kind of what that could look like. So I don't know that I'm going to give a set age. That I'm not going to say that, because I think it really truly does depend on the individual and the family and the condition that we're talking about as to when, because the more, particularly for some of these conditions, that we recognize that more females have symptoms than not, that I think our approach from the genetic counseling side is changing. It's going to continue to change in terms of how we approach that. I will admit, when I first started practicing, it was definitely, over 10 years ago, more of an approach of females we don't really need to worry about so much. It's been, my counseling absolutely has changed, and I am much more willing to kind of go through that process and talk through that with younger girls at this point.
Thank you so much. Beth, what was the process like for finding out that you were a manifesting carrier? What tests did they do?
Okay. So at the conference, there was a genetic counselor who was doing some research. And so I just was able to provide saliva in a tube. And then she took that and tested it. And then I got my results. For me, I have 4 older sisters, and one of them had children like mine. And that was like, she's quite a bit older than me. So it was like the early 80s. And they ended up doing a muscle biopsy on my mom and my sister. And unfortunately, my mom hid the truth from me and told me that it was just something that my sister had. And so I grew up never thinking this could happen to me. And so it was really very devastating. And I'm thankful that, I never had a child before I was ready, because it was very life consuming what happened. I mean, my son's care was so incredibly much. Like his respiratory system, we would suction his mouth and lungs 5 to 20 times an hour all day long. So it was a lot, and you had to be very vigilant, and that's not something everyone can deal with. And even with that, people told me, pull the plug, it's just too much, you can't do it. And I said, no, I can't pull the plug on my child. And it was a lot. And my son, neither one of them were supposed to live past a year, but they lived to be 24 and 27. And it was a lot of work, but I would do it all over again. I mean, it was worth it to me. But, a lot of young girls are having sexual relationships very young. And if they're not prepared, and, a 12-year-old gets pregnant and has a child with a lot of issues, that's a lot for the family to deal with. So, I just really encourage people to think about that kind of thing and not say, oh, they're too young to know, they're too young to deal with it. I don't think I definitely know I wasn't too young to deal with it. I was, I think 14, and my mom could have definitely told me, and I would have done well with that. And it was more devastating to me to have a child and not have any idea that I could have a child like that than if I had known at age 14.
Yeah, thank you so much for sharing. Karen, what was your family's response when you told them about your MTM diagnosis?
My mom and dad had died already then, so I couldn't tell them. It was very strange. I was married, and my sisters didn't want to know about it. I had to tell them because it's a genetic thing. And they just walked away and said, we just don't want to hear from you anymore. We stopped the relation, so they are out of my life. I don't know whether they did any research And I'm sorry to say, at this moment, I do not care. So we broke. What I like to say is, I think it's very important for young women, if they are having problems, if they have any kind of muscle disease within their family, maybe they have the diagnosis limb-girdle, and because the doctor think that's the one you have, and deal with it whatever you want. Please, and if you want to have a relation, and if you think about having children, please do check whether you are in a correct disease. Please check whether your diagnosis is correct, because I think many females are having the wrong diagnosis, and maybe they have limb-girdle or whatever, and then they found out they are pregnant and they have a child with MTM. I mean, that's just terrible. So please go find out if your diagnosis is correct.
Thank you so much for sharing, Karen. We have a question in the chat. Sorry if I missed this at the beginning, but I am curious about genetic counseling cost or reimbursement. Is this different by state and insurance provider?
Yeah, so it's unfortunately not a straightforward answer at all, because it truly is dependent on your state that you live in, and whether genetic counselors are able to bill for their services there based on, there's different factors in terms of whether insurances recognize them as billable providers, and whether the state has licensure within it. So it's somewhat changing and at this point, but I would just, when you find a genetic counselor, just ask those questions, because absolutely that's going to be a part of the process and talking through it. For some centers you go to, there won't be a cost to see a genetic counselor, and others there will be. And so it's truly going to be really case by case in terms of who you're talking to with that.
And our last question, what would you say is the biggest takeaway from these webinars, and specifically about genetic testing and genetic counseling?
From my perspective, my hope is definitely that we continue to learn more, because again, my own experience with it is that the way I counsel now about X-linked disorders is very different than I did when I started practicing 10 years ago. And I am hopeful that we will continue to do more research and include females within that to better understand what those phenotypes are, so that those of us meeting and counseling patients can have that information to provide and not have to do this piecemeal sort of approach for them.
Alrighty, we can go ahead and wrap it up then. Thank you all so much for attending and participating in this lovely webinar. This webinar has been recorded and will be posted on our website at a later day if you would like to watch it again or share it. Thank you so much for joining us, and we hope you have a great rest of your day.